Millions of men take finasteride or dutasteride, but they don't actually understand how it works. Does it work at a surface level where it's just the scalp, or is it systemic? Well, just to answer that, it's systemic. It is a hormone that you're quite literally inhibiting. What do these exactly do? So we have something called the 5-alpha reductase enzyme, which is at the scalp what allows our body to convert testosterone into something called DHT. And typically we do need DHT for a variety of reasons, whether that's anabolic signaling or rather growth overall, especially during puberty, such as penile development and other cases, especially just developing as a man. So it's very crucial as a man to ensure that you have some level of DHT, not only for growth, but proper development, especially through the teenage years. But this is where the issue comes in. A lot of men go through things like male pattern baldness and a variety of other hair issues, which is typically what leads to hair loss around the corners and the crown. Why don't we just inhibit it? Well, people do. We use things like finasteride, dutasteride, RU58841, etc. to address these problems. So the first one I'm going to be going over is just 5-AR inhibition in itself, right? With DHT, what happens is on a scalp level, especially as men age, they go through something called male pattern baldness, which is typically common in about 70 to 90% of men. I'm not sure if that's just the US or if that's globally, but typically it's genetic. It falls from your mother's side. However, the issue comes in is that because it causes hair loss, many people try to avoid it, try to suppress it with these 5-AR inhibitors. So here's the bottom line here. DHT with the 5-alpha reductase enzyme allows it for testosterone to convert into DHT, which causes hair follicle miniaturization, which essentially just means your hair thinning out. You start getting bald spots. But this is the kicker. A lot of people misinterpret this because it's not always just male pattern baldness where you just have specific spots that you start to recede in. There's also things like androgenic alopecia and a variety of other forms of DHT related hair loss, or even hair loss in general from other causes. So I'm specifically going to be talking about DHT causing accelerating male pattern baldness as well as androgenic alopecia. So the difference here is that androgenic alopecia typically occurs from steroid use or other things. But generally speaking, it causes a lot of spots where you just start balding, thinning. This is what I have. I don't have male pattern baldness necessarily, but rather a mixture of those. So what did I do? I took dutasteride, the first option. So to be clear, there's a clear difference between androgenic alopecia and male pattern baldness. Now with androgenic alopecia, what we do know is that not only is it spontaneous or random, but because DHT binds to the actual androgen receptors themselves, which causes further hair loss. So it's not a question of how much DHT do I have, it's a matter of how sensitive are my hair follicles to thinning in response to DHT binding to these androgen receptors. Here's some key things. We have a lot of treatment options, right? I'm going to go over the portion of steroid use in combination with it and just overall. Typically speaking, with things like treatment options, we have minoxidil, RU58841, ketoconazole shampoo, dutasteride, finasteride, as well as ketoconazole. Now let's talk about androgens specifically DHT-derived androgens, specifically things like Anavar, Masteron, Primo, things like that, right? Here's the kicker. They are direct DHT. What do we know about 5-AR inhibitors? They prevent the enzyme from converting testosterone into DHT so that there's less hair follicle miniaturization. But here's the issue. We can't do that when it's directly DHT. It's going to cause excessive hair loss, especially people that are more sensitive to these DHT compounds. So what do we do about it? Absolutely nothing related to 5-AR. However, despite those 5-AR inhibitors, you can technically take something like minoxidil, specifically oral form, or even RU58841. Now here's the difference between RU58841 versus finasteride and dutasteride. The key difference is the fact that RU58841 simply prevents, rather instead of preventing the conversion, it reduces the conversion of DHT. So it essentially binds to the androgen receptor because it's an androgen receptor antagonist, meaning that it prevents that conversion, especially at a local level, specifically your scalp. So you're less likely to lose hair, but again, it's still not effective, especially when you're on DHTs like Mast or Primo. You'll notice that a lot of people experience severe hair loss from it. So what do? Simple, nothing. Get off it, get off it. If you want your hair, you're not gonna wanna be on those things. Here's the other issue. People think, oh, maybe if I switch to something like 19 Nors, I'll be fine, right? No, wrong. So the issue with 19 Nors is that you can still technically take finasteride or dutasteride. Thing is, 5-AR inhibition does not work. In fact, it can worsen it because when we have something like 19 Nors, they convert into something called DHN. Now, the issue with DHN is that finasteride does block that, but it ends up creating a whole mess where that toxicity cannot be relieved or rather reduced, and therefore it leads to worse hair loss. So we still can't use these 5-AR inhibition techniques when you're on 19 Nors or DHTs. So again, steroids are out of the question except for testosterone or testosterone-derived androgens. So what do? Let's say we're natural, right? Completely natural. Now the trick here is simply to use the common method. Now, typically people's first option is finasteride. But the thing is, I always stray away from that. Use finasteride as your simple test option, meaning you start with it and you're just kind of experimenting. Because again, we do know that finasteride is only 60 to 70% effective at preventing hair follicle miniaturization, meaning it does not fully prevent that DHT conversion at the scalp, especially despite it being systemic, right? So we aim for something like dutasteride, which has a much higher efficacy, closer to 90%. So of course, why not go that route? In fact, the issue is that people don't actually experiment with doses. So when they actually get it prescribed, they immediately start off with 1 milligram, which is fine, or even dutasteride, 0.5 milligram. But again, we are different human beings, different level of androgen sensitivity at the hair scalp level, and etc. So that doesn't mean we can take the same dose and expect the same result. In fact, I'm on 1.5 milligrams of dutasteride, unlike the common prescribed dose of 0.5 milligrams. So who should actually avoid these 5-AR inhibitors? Well, it's specifically people that are on 19 Nors or DHT derivatives, or people that already have extremely low libido, because you still run into that potential risk. But let's go over some of the risk profiles, because I feel like it's way more overinflated than it actually is on paper. In fact, within studies, I'm going to be reading text straight off ChatGPT to give you a baseline understanding of how effective it is and how unlikely it is that you'll have libido issues because of these 5-AR inhibitors. So first of all, across RTC summarized in Lee et al.'s meta-analysis, so a meta-analysis across a range of different studies, decreased libido in individual trials ranged from 0% to 6 to 7%, with many trials around 1 to 3%. So if you pool finasteride 1 milligram trials in the table that actually reported libido, it comes out to about 2.9% on finasteride and 1.9% on placebo. So a plus or minus 1% difference. And then with dutasteride, it was 4.5% versus 2.2% on placebo. A small difference. And then the FDA's label, libido decreased 7% with finasteride and 5.7% with placebo. So we have it here. It's highly unlikely that you'll ever even experience these libido issues unless you're a genetic anomaly with the potential risk of being the 1% of participants that experience these issues. So I want you guys to worry less about this and in fact, experiment a bit more. It's not medical advice, but rather talk to your doctor. Ask them, is this really the right dose for you? Now, there's a ton of telemedicine pharmacies that you guys get from, but I would highly advise that you guys go to a dermatologist or some other option to ensure that you guys are effectively getting the right dosages in check. Because at the end of the day, when we do start with something like 1 milligram of finasteride, that may not be effective. Then we switch to dutasteride, which is more effective, 0.5 milligrams. Maybe that's not effective enough. From my personal experience, I had very little side effect. I had no side effects, in fact, with dutasteride on 0.5 milligrams, but it wasn't effective enough to prevent my androgenic alopecia. So I bumped it up to 1.5 milligrams after bumping it up to 1 milligram. Some people take upwards of 2.5 milligrams. Now, The real issue is the fact that many of you guys are not willing to go to your dermatologist or whoever you're prescribed by and telling them the updates. The point of this isn't just to get a prescription, it's to constantly give them feedback. It's like when you try to help someone in the gym, you can't just expect them to follow something that you gave advice for 4 years ago. They need to change over time. So the same application is for dosages. Again, this is just a common standard practice in medicine. You want to properly titrate dosages based on response, whether that's measuring different markers, DHT levels across everything, right? Another key thing is when you do get your blood work, check your DHT levels. Make sure it's the ultra sensitive version. I highly recommend it to ensure that you are effectively in the right ranges, not over suppressing DHT, so that you still have some androgen sensitivity, but you still are able to prevent hair loss effectively. Now here are the treatments. So we have dutasteride, 0.5 milligrams, you can take that. And you can bump it up all the way up to 2.5 depending on your level of androgen sensitivity. And then we have something like finasteride, start at 1 milligram. That's typically what's prescribed, but you can increase it upwards to unknown amounts depending on what your doctor prescribes you and exactly what you need, what's effective. Now, here's the thing. A lot of these people will give up in the midst of it. Unfortunately, you need to stay on them for at least 4 to 6 months to even start seeing results. I had completely bald spots all around my head until I started taking 1.5 milligrams. So again, for me, it was different. So before I get into the rest, specifically RU58841 and minoxidil, let's talk about something really quick. Should you take oral or scalp, or rather topical 5-AR inhibitors? Simple. Oral. The reason being is that despite what people might say or labels may say, it is very clear in literature that despite something being topical, they will still have systemic impacts. In fact, it's just going to be a lower rate of absorption and it's going to be lower bioavailability, which means it's going to be less effective. More than likely, you're better off just taking the oral form. In fact, the same logic applies to minoxidil. Now, here's the issue. A lot of people get issues on minoxidil where their hair starts to dry out, their scalp starts to dry out. We don't want any of that. I've experienced it myself. So let me take oral minoxidil. And here are the few things that you need to watch out for. Oral minoxidil will decrease blood pressure and increase vasodilation, which just means ensure that when you do take it, your blood pressure is in proper ranges, especially when you do take it and when you don't take it. Because again, you can get into those blood pressure ranges that can be terrible for you. So typically you'll be prescribed something like 0.5 or 2.5 milligrams of oral minoxidil if you go through a telemedicine or even your dermatologist, right? I would opt for that. The only thing I would watch out for is ensure that, besides getting better pumps, ensure that you are not growing too much body hair. That's a big issue that I face where I have to constantly shave. The other thing I want to talk about is ketoconazole. A big part in your hair loss may not actually be DHT derived. It may actually be caused by a fungus called malassezia, right? It's this fungus that causes dandruff that builds up by eating through the oils in your scalp and then causing these big flakes, big yellow flakes, not to be confused with dry scalp where there's small little white flakes, right? So to treat that, we use something like ketoconazole shampoo to essentially kill the malassezia, to prevent dandruff, seborrheic dermatitis, and scalp inflammation. So you can definitely opt for that. Just make sure you use the right conditioner. Now, the other thing besides oral minoxidil and ketoconazole is specifically whether you should take something like dermapens. So here's the thing. There's something called microneedling in which you quite literally create little pores by needling once a week, whatever it may be. Now, before I cover that, I want to talk about something important. If you do decide to go down the route of taking scalp or topical minoxidil, ensure that you're not taking it at the same time as when you do microneedle, as this can cause serious infection. You're quite literally putting holes around your scalp. And if that gets absorbed, or if the minoxidil gets absorbed, it will cause some sort of infection potentially. I'm not going to say this is a guarantee, but you may run into that risk. So just be careful. If you're going to do minoxidil, just make sure you do it 6 times a week and then do the microneedling on the day that you aren't doing minoxidil. The last thing I wanted to talk about, like I said, was the actual pens themselves. So do not opt for the options where you find those $15 roller pins, whatever the fuck, on Amazon. Instead, opt for a more expensive version where not only do you have the actual stamp itself where you stamp it, it takes less time, it's a lot more efficient, and yes, you might be spending more, but the opportunity cost is right there. You spend less time, it's less annoying, you're more likely to do it. But on top of that, you are ensuring that you're using clean needles, because alcohol is not going to prevent that bacterial infection. So make sure that when you do get those pens, you get a set of needles that you can replace with every week or every couple of weeks to ensure that you don't run into that risk. Just to cover up, here are the few options. Start with dutasteride at 0.5 milligrams week or daily, or you can go down the route of finasteride 1 milligram daily. If finasteride doesn't work, switch over to dutasteride. If dutasteride 0.5 milligram doesn't work, increase the dose. Ask your doctor, ask your dermatologist. For minoxidil, 2.5 milligrams daily on top of that if you want, or you can do minoxidil topical. And on top of that, if you have serious androgenic alopecia, especially when you're on DHTs, use something like RU58841. I'm not going to tell you the exact dose because that's entirely dependent on the sensitivity of your hair follicles. And the last thing is, make sure if you're going to do minoxidil topical, you only do it every single day except for the day where you do microneedling, or don't do microneedling at all. You can combine all those at the same time. Obviously, don't do the same thing topical and oral. Pick one, depending on what works for you. But yeah, that's really it.